The effects of the COVID-19 pandemic left over 354,000 schoolgirls impregnated in 2020, and by June 2021, at least 196,000 teenage girls had become pregnant. The Ministry of Education and Sports instructed all primary and secondary schools to allow pregnant students to return to school so as to complete their education. The calls for pregnant girls to resume their studies made front-page news in various newspapers. Despite the president's announcement that pregnant girls should be allowed to access school, a number of church-founded schools barred pregnant girls from attending classes. Stigmatization and discrimination by teachers, parents, fellow students, and the immediate society are the major causes for pregnant girls discontinuing school. The Ministry of Education issued a 40-page document entitled Revised Guidelines for Prevention and Management of Pregnancy in School Settings. This document requires schools to have a health committee led by the chair and PTA and coordinated by the senior woman, who is responsible for handling issues of retention of pregnant girls at school and re-entry of adolescent mothers. The deputy head teacher of Bulucheke Secondary School, located in Bududa district, speaks of the situation at their school.
We actually opened on 10th of January this year, like all other schools in the country. And we have a total population of about 650 girls. Out of these girls, when we had just opened, at least we had some two coming to the office to tell us that they were pregnant, and we received them because government had directed that we should actually receive them in that state. Then later on, after like 2 weeks, we also carried out the routine medical checkup, and then it revealed more 5. So as I speak, we have got 7 girls who are pregnant, but they're in class because we cannot send them away. We have allowed them to study.
The relationship between teenage motherhood and schooling is explicit. When teenagers become pregnant, they abandon schooling altogether. But Grace, who is currently pregnant, decided to go back to school.
Bemenya boyfriend wasekunamo kuba ngoba sayithi menye wena engane sesona kala namunembi bona amathi oninda bani ndane ngabuye tikuthela.
There has been a change in the attitudes of some school administrations towards facilitating and caring for pregnant girls.
We have been allowing them, actually some of them have been coming to ask for permission to go to the nearest health centers for their antenatal services. And we have always actually been granting the permission to go out. And in the school here also have a full-time nurse. Sometimes when they feel like they have a health challenge, she's always on alert to attend to them.
Even with the government support for pregnant girls to go back to school, there has noticeably been low numbers of girls reporting to school. Some girls feel they deserve to be punished for getting pregnant, so they drop out of school, and others are too shy to return to school.
The enrollment, especially in those classes of senior 2-3, has slightly gone down, and the major contributing factor should be marriage. I think others have been married off. That could be the reason, because there are some parents who maybe had no courage to bring these girls back, and there are also those girls who could have got pregnant during the COVID lockdown, and they didn't have the courage to come back to school. So actually the major factor contributing to this, the drop in the enrollment of girls, is most likely to be marriage.
Education is a right, Continued change of people's thoughts, behaviors, and feelings towards pregnant girls, and including them into the society, is important to help them cope with daily attendance of classes.